When we think about keeping our older loved ones safe from falls, our minds usually jump to the obvious stuff, right? Slippery rugs, maybe some clutter in the hallway, or poor lighting. But what if one of the biggest risks isn't something you can trip over at all? What if it's hiding in plain sight, right inside the medicine cabinet? Let's dig into that.
Think about this for a second. More than 1 out of every 4 older adults has a fall each year, and that's not just a number on a slide. Each one of those falls can mean a serious injury, a hospital stay, and a loss of independence. It's a huge deal, which is why we've got to understand all the risk factors.
So this is the big question we're tackling today. We're going to pull back the curtain on how some of the most common medications, we're talking both prescription and over-the-counter drugs, can secretly increase the risk of a fall because of side effects like dizziness, drowsiness, or confusion.
Now, I know what you're thinking. The list of medications out there is gigantic, and this can feel pretty overwhelming. But don't worry. To make sense of it all, experts have a really helpful system. They basically group the riskiest drugs into 3 main categories. It makes it so much easier to understand what's really going on.
And here's our roadmap for this explainer. First, we'll look at drugs that mess with brain function. Then, we'll cover the ones that affect blood pressure. And finally, we'll touch on medications for blood sugar. That first category, the one that works on the brain, is by far the biggest one. So let's start right there.
Okay, Category 1, psychoactive medications. It's a fancy term, but all it really means is that these are drugs that act on your brain and central nervous system. And while they can be absolute lifesavers for certain conditions, they often come with a trade-off, side effects that can throw off your balance, slow down your reaction time, and just make you feel confused.
First up in this group are benzodiazepines, which are often prescribed for anxiety or sleep. You've probably heard of some of these, like Ativan, Valium, or Xanax. The main problem here is they can make you really drowsy and confused, and that risk gets even bigger for someone who's already struggling with memory issues. And this brings us to an absolutely critical safety warning. I really need you to hear this. You can't just stop taking these medications cold turkey. It is incredibly dangerous. They have to be tapered down slowly and always under the watchful eye of a doctor.
Right along those same lines, we have other prescription sedatives like Ambien or Lunesta. They're not technically benzodiazepines, but they're for insomnia, and the danger is pretty much the same. I mean, these pills are literally designed to make you sleepy, and that hangover effect can easily stick around the next day, making you less alert and unsteady on your feet.
Next up are antipsychotics. You'll often see these used to help manage some of the really tough behaviors that can come with dementia, or sometimes they're prescribed for depression. Drugs like Seroquel and Risperdal are on this list because, you guessed it, they can also cause major drowsiness and affect a person's thinking.
Let's move on to anticonvulsants. Now here's the thing, they're not just for seizures anymore. A drug like Neurontin is super common for nerve pain, and others like Depakote are used as mood stabilizers. What's so important to remember is that it doesn't matter why you're taking them, the side effects of drowsiness and dizziness are still there, creating that fall risk.
This is a really big one. Antidepressants. A lot of the most common ones out there, Zoloft, Lexapro, you name it, can cause drowsiness or dizziness. And some, like Trazodone, are actually prescribed because of their sedative effect to help people sleep. So with that one, the fall risk is kind of built right in.
And of course, we have to talk about opioids. Everything from codeine to oxycodone, these are incredibly powerful drugs for serious pain. But we all know they're also powerful sedatives. The risk is so well known that the CDC specifically says that reviewing opioid prescriptions should be a standard part of any fall prevention plan.
All right, this next category might be the one that surprises you the most because it shows just how widespread this problem is. We're talking about anticholinergics. This is a huge class of drugs, and it includes stuff you can just buy off the shelf at any pharmacy, like Benadryl for allergies, Tylenol PM for sleep, or Dramamine for motion sickness. These are so common we don't even think about them, but they have a really strong link to drowsiness and confusion.
Okay, we've made it through the biggest category, the medications that affect the brain. Now let's switch gears and talk about the other 2 major groups, drugs that have a big impact on the body's other systems, starting with blood pressure.
So medications for high blood pressure are designed to do one thing, lower it. But here's the catch. Sometimes they work a little too well, or they can cause a sudden, really sharp drop in blood pressure when someone stands up too quickly. It's a specific condition, and that immediate wave of dizziness or feeling like you're going to faint is a direct path to a fall. This group also includes drugs like Flomax, which is often used for prostate issues.
And that brings us to our third and final category, medications for diabetes. Their whole job is to keep blood sugar from getting too high. But if the dose is off and blood sugar dips too low, that's a state called hypoglycemia. It can trigger a whole cascade of problems: weakness, shakiness, confusion, and dizziness. And that's a dangerous recipe for a fall.
So now that we've gone through all these risky medications, the million-dollar question is, what do you actually do with all this information? Let's shift from just identifying the problems to creating a real, practical action plan that's actually safe.
Okay, the single most important thing to remember is that you are not in this alone, and you should not be making any changes by yourself. The goal here is not to play doctor. It's simply to start a conversation with a healthcare professional, a doctor or a pharmacist, who can look at the whole picture. The CDC actually has a very clear, three-step approach that doctors and pharmacists use. First, they ask, can this medication be stopped altogether? Maybe it's not even needed anymore. If it is still needed, can we switch to a safer alternative that has fewer side effects? And if that's not an option, can we reduce the dose to the lowest possible amount that's still effective?
I'm going to say this one more time, even louder, because it is the most crucial point of this entire explainer. Never, ever, ever stop or change the dose of a medication without talking to a doctor first. Seriously, doing it on your own can cause really bad withdrawal, make the original problem worse, and be incredibly harmful.
And let's be realistic here. The goal isn't necessarily a completely empty medicine cabinet. For a lot of people, these medications are absolutely essential for their health. The real objective is to have an open, informed conversation and consciously decide if the benefit of that drug is truly worth the potential risk of a fall. It's all about finding the right balance.
So we'll leave you with this final thought. We spend so much time and energy looking for hazards on the floor. But maybe, just maybe, the most powerful safety check you can do doesn't start with a walkthrough of the house. Maybe it starts with a simple list of medications and a conversation with a doctor. Could that one simple talk be the real key to protecting the health and independence of someone you love?